Hi, Nick here with MedTech World. Margaret Kalmeta with Rapid Nexus. Good to have you.
Thank you. Nice to be here.
You're the CEO of this business that's involved with tissue, with
Yes.
regenerating tissue, right?
Yes, exactly. So we focus on regenerating tissue surrounding a chronic wound. We are the world's first neuropathy and tissue healing product surrounding a wound.
Lovely, which is quite different than what's on the market in general. in
Very
regards to
different than
wounds.
what's on the market. Right now on the market, we have the entire wound care industry that is focusing on just the wound itself, plugging up the hole. In a diabetic patient, you have neuropathy, varying levels of tissue degeneration. Those wounds aren't healing. Patients are rolling into amputations, sepsis, and passing away. So we are bringing to the world the first product to actually address the real problem, which is not the hole in the leg, it's actually the tissue surrounding the hole, which prevents that hole from healing.
Cool. I'm going to assume it's advantageous to do it this way. Are we looking at shorter healing time?
We're looking at shorter healing time, but really what we're looking at is durable healing, because currently in the wound care industry, even if a wound closes, it only closes for a diabetic individual, that is, or for a very chronic wound. It'll close at the surface level and reopen. And we are a durable solution. We handle the wound healing from the inside out. And so we are very different from the industry in that aspect as well.
In general, what is the demand? What is the need for what you have?
Oh boy, okay. So healthcare spends about $360 billion a year for this patient population base. There are, in the US alone, 1,380 amputations every day. Every day. And that's not from an accident, a war, that's just because someone has diabetes and they're unable to heal. So, you know, the amount of money that healthcare is spending on the varying degrees of tissue plugging up products that are out there is very large. These patients go for many decades even with a wound, living with a wound, learning to live with it. At any point in time, they could get infection and sepsis, pass away from the wound. So that's why amputation is diagnosed, to prevent sepsis.
How long have you been in the market? What has been the uptake of the product so far?
We're still pre-market. We're filing our 510K right now. Q1 2025 will be entering the market. We've attended several wound care conferences, and the excitement level was very, very high because this is a true unmet medical need.
That's amazing. And what do you need for a rollout? Are you backed? Are you financed to go the whole hog?
We're financed to get through getting into commercialization, and then we'll be seeking more financing to do the full commercialization for the next couple of years.
Wonderful. We're all looking forward to following your story. Really hope it's a successful one.
Thank you very much.
Margaret, thanks for being with us.
Thank you. Appreciate it.
Nicholas signing off from MedTech World.